Burping your baby is very important. It's a simple yet crucial part of your baby's feeding routine that can make a big difference in their comfort and well-being. It helps your baby feel better by releasing the trapped air that can cause discomfort and fussiness. When babies eat, whether they are breastfeeding or bottle feeding, they tend to swallow air along with their milk. This swallowed air can accumulate in their tiny stomachs, making them feel bloated and uncomfortable, which can lead to crying and restlessness. Burping helps get rid of the air, providing relief and making your baby more comfortable. There are different techniques to burp your baby, such as holding them against your shoulder or sitting them upright on your lap. Burping your baby can also help them sleep better. A baby who is free from gas and discomfort is more likely to settle down and enjoy a peaceful sleep. Additionally, it can aid in their digestion, ensuring that they get the most out of their feedings without the interruption of gas pains. Make burping a part of every feeding session. It's a small step that can have a big impact on your baby's overall happiness and health. Your baby will be happier and healthier, enjoying their feedings and the time spent with you. You will feel better too, knowing that you are helping your baby feel their best and fostering a strong bond through this simple act of care. Burping is a sign of love and care for your baby. It's a gentle reminder that the little things you do can make a big difference in their world. Babies often swallow air when they are feeding. This is a common occurrence and nothing to be overly concerned about. This happens whether they are breastfed or bottle-fed. The method of feeding doesn't significantly change the likelihood of swallowing air. When babies latch onto the breast or bottle, they create suction. This suction is necessary for them to draw milk into their mouths. However, this suction can cause them to swallow air along with their milk. The air can get trapped in their tiny stomachs, leading to discomfort. Some babies swallow more air than others. This is normal and can depend on various factors such as the baby's feeding position and the type of bottle or nipple used. It is important to burp your baby often. Regular burping helps to release the trapped air, preventing gas buildup and discomfort. This will help to release the trapped air. Gently patting or rubbing your baby's back can assist in bringing up the air bubbles. You should burp your baby during and after each feeding. Taking breaks to burp your baby can make feeding more comfortable for them and reduce the chances of spit up. Holding your baby upright for a few minutes after feeding can also help. This position allows gravity to assist in releasing any trapped air. There are various burping techniques you can try, such as holding your baby over your shoulder or sitting them on your lap. Find what works best for you and your baby. Remember, every baby is different. With a little patience and practice, you'll find the best way to keep your baby comfortable and happy during and after feedings. Trapped air can cause your baby a lot of discomforts. They may become fussy and cry more. Your baby may also spit up more often. The trapped air can cause gas pains. This can be very uncomfortable for your baby. Trapped air can also make it difficult for your baby to sleep well. They may wake up often or have trouble settling down. Section 4. Effective techniques for burping your baby. Burping your baby is an essential part of their feeding routine. It helps to release the air that babies tend to swallow while feeding, which can cause discomfort and fussiness. There are many different ways to burp your baby, and finding the right technique can make a big difference in your baby's comfort. You can try different positions to find what works best for your baby. Each baby is unique, and what works for one might not work for another. One way is to hold your baby upright against your shoulder. This position allows the air to rise naturally and can be very effective. Another way is to sit your baby on your lap and support their chest and chin. This position gives you good control and allows you to gently pat or rub their back. You can also lay your baby on your lap on their belly. This position can be particularly helpful if your baby is gassy or has trouble burping in other positions. No matter which position you choose, gently pat or rub your baby's back. The key is to be gentle and patient, as it might take a few minutes for the burp to come out. This will help to loosen the trapped air and provide relief to your baby. A successful burp can make your baby feel much more comfortable and happy, reducing fussiness and making feeding times more pleasant for both of you. Section 5. Making burping a part of your routine. Make burping a regular part of your feeding routine. Burp your baby during and after each feeding. This will help prevent discomfort. Every baby is different, You may need to experiment to find what works best for your baby. Burping your baby is a great way to bond. It is a time to relax and enjoy each other's company.